they had been fully vaccinated. The results of this analysis that DHEC performed is similar to the results being reported nationally and from many other states as well. In fact, every analysis that I have seen continues to show that the overwhelming majority of people who are continuing to get COVID-19 and who have severe disease or have been hospitalized or are dying from COVID-19 were those who were not fully vaccinated. I mean, I can't think of a more impactful point to make that would encourage someone to get vaccinated, to receive their shots right away. As Dr. Kanuka mentioned last Wednesday, we are seeing states such as Missouri, Arkansas, Florida, and other southern states experience outbreaks and a resurgence in cases due to low vaccination rates among their statewide populations. And those large numbers of unvaccinated people are allowing the Delta variant to get a strong foothold. Our state and our nation, for that matter, are at a pivotal point in this pandemic, and the way to end it is readily available. Vaccines are our way out of this pandemic. We need more of our population vaccinated if we want to beat this for once and for all. If you know someone who hasn't been vaccinated, please talk to them about why it's so essential for them to do so. Offer to take them to a vaccine provider, offer to help them get their shot, or encourage them to at least learn more by getting facts from DHEC or from CDC. For all of you who are fully vaccinated, thank you for protecting yourself and protecting others, protecting your community, and doing your part to stop the virus in its tracks. I mean, to give a short recap of where we are in this ongoing epidemic, remember that vaccines work, including against the Delta variant and the other variants that are circulating. Unvaccinated people or people who are incompletely vaccinated, have had only one dose of vaccine, remain vulnerable to this deadly disease. And until more people are vaccinated, remember the virus could mutate further and new variants could evolve. Vaccination, as I said before, is our way out of this. Thank you.
Thank you, Dr. Kelly. At this time, we'll begin the portion of the briefing where we answer the submitted questions. And starting with the first question, Dr. Fauci says in areas where there are low vaccination percentages, he recommends that people, including those vaccinated, wear masks as an extra protection step. Is this necessary considering the estimate that 99% of those vaccinated are protected?
I think that Dr. Fauci qualified that statement to recommend masks specifically in areas where vaccination rates are very low. So in places where most people are not fully vaccinated, it's easier for these highly transmissible variants like the Delta variant to spread, to continue to spread. And so he's asking people who live in those low vaccination areas to go that extra mile because of his concern about continued spread of highly contagious variants.
Thank you, Dr. Kelly. And next question, has there been a significant increase in COVID-19 cases in South Carolina following the July 4th holiday?
You know, it's really too early to tell. It's going to take at least a few more days for us to look at the numbers to see if the state is experiencing a surge in cases following the holiday weekend. Remember that the incubation period, the time period between exposure to the virus and the development of disease can be as long as 14 days. And then if there's secondary spread from people infected 4th of July, who then may transmit infection to others, we won't really know the full impact of 4th of July weekend for several weeks to come.
And piggybacking off of that question, what kind of surges in cases have been linked to recent holidays? So for example, was there a surge noticed after Memorial Day? And if so, how bad was it?
We have noticed an uptake in cases after most holidays over the course of the past year, and that's multifactorial. It's because group gatherings are the prime disease transmission route if proper prevention methods such as masks and distancing aren't in place. And we continue to see cases with reported exposures when it's travel related, when people are traveling to go to venues, festivals, activities, indoors and outdoors where COVID may spread to groups of at-risk individuals. So in recent weeks, our number of weekly reported COVID cases have increased slightly, which may be reflective both of that, the impact of the Delta variant and all the variants of COVID for that matter, along with broader movement of individuals and participating activities where transmission may occur from infected individuals to those who are at risk. And again, I just want to emphasize the biggest risk factor right now is not being vaccinated.
Thank you, Dr. Kelly. And speaking of the Delta variant, we have several questions lined up for that. The first one being, what is the status of the Delta variant in South Carolina?
So on our website, we are currently reporting 10 cases of the Delta variant identified in South Carolina. Although, as mentioned before, we know that there are more cases of the Delta variant out there. We are doing a sample of variant analysis. The best thing you can do to protect yourself from the Delta variant is to make sure you're fully vaccinated. Encourage your friends and family to get their shots as well. I mean, the studies continue to show that the 3 vaccines that are approved in the United States are successful in preventing severe illness with the Delta variant.
And next question, how big of a concern is the Delta variant?
It is a big concern. I know I just finished saying we are reporting 10 cases of the Delta variant in South Carolina, but we know that there have to be more cases than that out there. We know that in the nation as a whole, right now, more than half of the new cases are the Delta variant. Do you remember months ago how concerned we were about the Alpha variant when the Alpha variant first started to spread in the US because it was more transmissible? Well, the Delta variant is even more transmissible than Alpha is. Right now, for example, Missouri is having a frightening surge in COVID-19 cases, overwhelming some of their hospital systems, and 96% of those new cases are Delta variant. We don't want that happening here. We need to increase our statewide vaccination rates.
Thank you, Dr. Kelly. Next question, what percentage of new cases of coronavirus in the state are the Delta variant?
Of the 195 samples sequenced at DHEC's public health lab in June, 78% were known variants of concern. Then there were an additional 11% of some other known variants, and the remaining 11% were not identified as variants. But in answer to your direct question about the Delta variant, 5.2% of the variants of concern that were sequenced at the lab in June were the Delta variant.
Thank you, Dr. Kelly. And the next question, I think you've kind of been speaking to it, but why should the general public pay attention to the Delta variant?
Sure. South Carolina is one of 12 states considered at highest risk for new outbreaks because of our low vaccination rates. I know we just finished saying that we're glad, we're celebrating that almost 50% of people in South Carolina have received at least 1 dose of vaccine. We're looking forward to achieving that milestone. But the worrisome concern is still that only 42.9% of those aged 12 and up have been fully vaccinated in South Carolina. I can't say it often enough. Vaccines work against the Delta variant. Now is the time to get vaccinated before school starts and before the Delta variant hits South Carolina hard.
Thank you, Dr. Kelly. And the next question, does it surprise you that the case count for the Delta variant is low across the state?
It doesn't surprise me. As we've noted before, we know that there are more instances of the Delta variant in our state than what we've identified, since not every COVID positive sample is sequenced for variants. We know Delta variant is here. We're concerned it's going to spread quickly, just as it has done in other states with low vaccination rates. The public health recommendations overall for protection against the Delta variant are the same. Wear a mask, avoid crowded public settings, keep your distance, wash your hands. But the most effective thing you can do by far is get vaccinated.
And next question, case numbers are climbing nationally. Does DHEC see this as an aberration, or does the department expect South Carolina case counts to follow suit?
Case numbers have already been recently trending upwards for South Carolina, though not as dramatically as for many other states. I think the important message here is that we need to avoid feeling complacent. Now, having a large number of unvaccinated people means that there is real opportunity for the Delta variant to invade and for the virus to mutate further.
And next question, has there been any update on the need for booster shots for certain vaccines?
Some individuals who have severe immunocompromise, for example, people who are organ transplant recipients, they have benefited from getting a third shot to increase their immune response. But for the general public, there's no need for booster shots at this time. All three vaccines available in the US are highly effective against all the circulating variants.
Thank you, Dr. Kelly. Next question, have hospitals ramped down their capacity to treat COVID-19 cases since the situation has improved? If so, how quickly could hospitals return to a level of operation needed to handle a surge?
I don't have specific details about each individual hospital and how they're adjusting their operations now that we're achieving a decline in COVID hospitalizations. But I don't have any doubt that if we were to experience a resurgence or another wave of cases in our state, that our hospitals would be ready to accommodate an influx in COVID patients. All of our hospitals have surge plans, all have other preparations in place for how to accommodate and safely take care of an influx of patients. Those surge plans were put in use over the course of the past year as this pandemic unfolded, and many partnerships were formed. DHEC also has agreements with the South Carolina Hospital Association to work cooperatively in identifying additional bed space in other hospitals if there were potential for patient transfer or for the exchange of supplies, equipment, or if staff shortages should occur.
Thank you, Dr. Kelly. And next question, how would you describe the state's testing capacity right now?
Testing for COVID continues to be offered by both DHEC and their partners. The CDC and DHEC both recommend that anyone with any signs or symptoms of COVID-19 get tested, regardless of vaccination status. Even if you're fully vaccinated or have prior infection, if you have symptoms of COVID-19, you should get tested. Fully vaccinated people with no COVID symptoms don't need to be tested following an exposure to someone with COVID-19. They don't need to quarantine. They don't need to be tested if they've recovered unless they have new symptoms. Unvaccinated people are a different story. Unvaccinated people who have taken part in activities that put them at higher risk for COVID-19 because maybe they couldn't physically distance as needed to avoid exposure, or such as travel, or attending a large social or mass gathering, or being in a crowded or poorly ventilated indoor setting, they should be tested.
Thank you, Dr. Kelly. And last question, or at least the last one for the submitted questions. Are you aware of any data from the UK showing the Delta variant killed more vaccinated people than unvaccinated?
I know the article that you're talking about, and I think it's terribly misquoted. This is a classic case of the misuse of statistics, because it looked at a small number of people who had been fully vaccinated. I think the number was 26 people who had been fully vaccinated in the UK who died of COVID-19. Remember, nothing in life is 100%. A very small number of people who had been vaccinated did die of COVID-19. I think they were largely older people, people who had other medical problems, people who had conditions that might render their immune system less responsive. But in terms of, did the Delta variant kill more vaccinated people than unvaccinated? No. And they were looking at a proportion among people who have been tested. If you want me to go into more details, I can. But basically, I think it is quoting some numbers out of context and failing to understand that a certain number of people inevitably, even if fully vaccinated, may contract COVID and have a bad outcome. But it pales in comparison to the number of people who are unvaccinated. Just as I mentioned earlier, in South Carolina, in the first 2 weeks of June, 100% of the deaths that we had were among people who were unvaccinated.
Thank you, Dr. Kelly. And so at this time, we'll begin our live Q&A. Please remember to keep your end muted unless you're asking Dr. Kelly a question. And with that, I see that the first hand raised is Chris's. Chris, do you have a question?
Hey, Dr. Kelly, thanks for the time. I know you've touched on this, but I just want to get a clearer sense from you. Looking at national outlets, quite frankly, NBC News, for example, says over the last 14 days, we've seen a 55% rise in cases. Meanwhile, the New York Times says that we've seen a 14% rise in cases. This is, of course, South Carolina based. Want to get a sense from you, how would you characterize this rise in cases that you've allured to in this conversation so far?
So nationally, there has been a greater rise in cases than we have seen in South Carolina. But that's kind of been true throughout the pandemic, that South Carolina has lagged behind what was going on with national statistics. That you'll remember, last year in the spring, our numbers were fairly low compared to outbreaks elsewhere in the US until after 4th of July, we had a surge, and then we had that huge surge after the end of year, Christmas, New Year's holidays. So the fact that right now, nationally, there's a bigger surge than we're seeing in South Carolina should not be reassuring. We're very concerned that the Delta strain is here and will continue to spread quickly because we've got a large unvaccinated population. So I'm not sure if I'm addressing your concern. You're asking nationally, the numbers are way worse than they are in South Carolina. So is that reassuring? No, it's not. I hope I'm answering your question.
Thank you, Dr. Kelly. Does anybody else? Oh, Chris, did you want to respond?
Yeah, I think so. So is it a question of when and not so much if that we will see something similar to the scale of the national rise?
I hope not, but that's certainly a possibility. My hope lies in people getting, an increase in understanding of the need to be vaccinated, because I think at some point in South Carolina, many people were feeling it's just not that important. And I hope that we can bring back into sharp light that it is very important. It is still very important to get vaccinated. I won't go so far as to say it's a definite question of when, not if, because there are things people can do. This is not inevitable that we continue to have hospitalizations, cases, hospitalizations, and deaths. There are things we can do. The number one thing you can do is get yourself vaccinated, encourage others to do so as well.
Thank you, Dr. Kelly. And Dana, I believe you're next. Do you have a question?
Yes, sir. Hi, Dr. Kelly. It's been long been a concern that people will reach COVID fatigue, as in, I am so tired of hearing about this. How do you offset that, and how do you let people know it is not over yet, people?
Personally, I think the best way is by personal stories. I think we are now down to the point where it is one person talking to another person. And I don't mean just healthcare providers talking to patients. I mean all of us telling our personal stories, because those are what are most compelling. The individual thinks, I'm not worried about getting, thank you for showing your vaccination button. I think it boils down to people telling their stories, including, I thought I wasn't at risk because I wasn't worried, I'm young and healthy, and then I brought it home to my mother who has diabetes and wasn't vaccinated. Or, the tragic stories of bringing it to the grandparent who then dies. But I think it's also telling the personal stories of why. Why did you get vaccinated? Some people get vaccinated not so much for themselves, but to protect others. And what were their personal experiences? People are still afraid of being vaccinated because they have heard rumors. And I think actually knowing someone, talking to someone about their personal experience will make a difference.
Thank you, Dr. Kelly. Chris, I see your hand is still up. Did you have another question?
Yes, I did. And thank you, Dr. Kelly, for your time and your help on this. So I kind of want to return to my first question a little bit while you were answering the question of my colleague. The data from NBC News, for example, shows that there's a roughly 7% climb in cases nationally, but perhaps in South Carolina, that's 55%. And meanwhile, New York Times shows different data, but a similar trajectory, I suppose, a 14% climb nationally and something dramatic like 162% in South Carolina. So I guess when you speak to it's not as bad here as it is maybe nationally. I guess what are you pulling from, and can you kind of give me a sense of where you're getting that data, I suppose?
Yeah, sorry, I misinterpreted your question, but let me back up and explain what numbers I was working from. So if we look at the national rate per 100,000 people of cases of COVID-19, nationally that's 22.8 per 100,000. In South Carolina right now it's 12.7 per 100,000. So that's what's the rate per 100,000, how many cases per, that unit of population. There's another way of looking at it, and I'm sorry that I misunderstood what you were saying earlier. Another way of looking at it is percentages. So a percent rise. So let's say we have 100 people diagnosed with a new COVID-19 diagnosis in a given day, and then the next week we have 200 people diagnosed. It's an increase of only 100 people, but it's a doubling. It's 100% increase. So South Carolina, our numbers had gotten small enough that even a small increase per 100,000, a small increase in absolute numbers, is a large percent increase. Let me try and explain that one more time. If you have 100 people on one day and 200 people the following week, it's a small increase in absolute numbers, but as a percentage, it's 100%. It's a doubling.
So, okay, I follow there. So in terms of percentages, maybe not as alarming. Is that a fair assessment?
We still have fairly, I'm being careful with my words here because I don't want anybody to be terribly reassured by this. We still have fairly low community transmission in most places across the state, but boy, we are just lucky because the percentage of people who are unvaccinated is high. So we're very concerned that we may have a surge as the Delta variant increases across the state.
I follow. Thank you, Dr. Kelly.
Thank you, Dr. Kelly. Zach, do you have a question?
Yes, thanks, Dr. Kelly. I appreciate you taking the time today. My question was with respect to the study that you guys had done of the breakthrough cases in the first 2 weeks of June. I was wondering if you had any more information about the ages, race, or medical conditions of the vaccinated people who had ended up getting COVID and were hospitalized.
Sure, we have that information. I don't have it in front of me. I didn't prepare that for this, but we definitely do have that information. I can say for cases nationally, it is more likely the people who become who are vaccinated, who are hospitalized, and suffer bad outcomes with COVID-19. They are more likely to be among those who are elderly or have other chronic medical conditions that render them less likely to have a robust immune response. So in answer to your question, what about these cases in South Carolina? I don't know those details off the top of my head, but we could get you those details. Right now, those data are provisional, so we're still continuing to examine them. We don't have all the information on all those patients analyzed as yet.
Thank you, Dr. Kelly. And Zach, if you'll follow up with an email to us, we can work on getting something to you.
Definitely. Thank you.
No problem. And does anybody else have a question for Dr. Kelly? And Chris, you have another question?
Yeah, thank you again for your time, Dr. Kelly. So there's been a lot of pushback nationally about the idea of mandates. And I know you can probably only speak for yourself here, or if you even want to touch this topic, but I guess, what is your thought process? When do you feel like maybe we need to start moving or start seriously considering that option when it comes to getting us to where we feel like we need to be on this front?
I think we do need to keep all those mitigation measures in mind, and that we, at this point, if a person is unvaccinated in South Carolina, that it still is in their own personal best interest to wear a mask and remain distant, especially in indoor settings. In terms of a mask mandate, I think the South Carolina's position on a statewide mandate has been clear. We are coming up soon on making decisions around school policies and making, CDC's recommendations around school guidelines, and DHEC will be basing our recommendations on the CDC and working with individual school districts to make those decisions. But if you're asking when do we need to implement that, well, I think it's concerning right now the number of people who are out there who are not vaccinated and not masking. This is not over yet, folks.
Thank you, Dr. Kelly. Zach, did you have another question?
I did, thank you. Yeah, I was just wondering if you could comment at all on, I'd seen some news coverage that was saying that the symptoms presented from infection with the Delta variant were somewhat different than other variants or from the original strain of the virus. Do you know if that is in fact the case, or are the symptoms the same?
I think that can be what's termed ascertainment bias. Think about the early days of COVID-19. Nobody knew about the change in taste and smell. And then as we learned more about symptoms, we realized, oh, this is a symptom of this virus we didn't appreciate before. Now everybody knows about the change in taste or smell. And so I think people are looking for other subtle symptoms that maybe were not recognized previously. But there's nothing about the Delta variant that makes me think from a biological point of view or from a medical point of view that it should have cause different symptoms or a different presentation. It may be that people are just more sensitized to it. What's different about the most important thing that's different about the Delta variant is how much easier it is to spread. It's got a better spike protein adhesion factor, so it's just better to adhere and get into cells.
Thank you, Dr. Kelly. Chris, did you have another question?
Yes, I did. So, Dr. Kelly, it seems like the vaccines that we have now, obviously, they will work against Delta. But thinking broadly here, how much more, do you have a sense of how many more times this virus can mutate, and what we built for the, original virus would still work? Understanding that is kind of a broad question, but is there like a timeline for these type of things when it comes to viruses generally?
That's an important question, because it feeds into understanding how vaccines work. So when you receive any of the 3 available vaccines, what they do is stimulate your immune system to do several different things. And that's what's really key. The fact that it stimulates the production of antibodies, and antibodies are not it's a plural, right? Not a single antibody. You get multiple antibodies to different parts of the virus, to different parts of the spike protein. So when we talk about there's a mutation in the spike protein that makes it more transmissible, more contagious, well, that's a serious concern, because that means virus can spread more easily. But the vaccines make antibodies not just to that one part. They make antibodies to multiple parts of the spike protein. And it's not all just about antibodies. There are other factors in your immune system, things called killer T cells, memory cells, and all of these vaccines produce those T cell responses as well. So there's always that concern that, are we going to get a mutation so that the vaccines don't work? But we're not seeing that yet. The kinds of mutations we're seeing are the kinds where they attach the virus more easily, or they're not as responsive to the monoclonal antibodies, the medication, the passive antibodies that we give. But so far, to all vaccines, it's been, a robust reaction, and that's because your immune system has many moving parts, and the vaccines affect all of those moving parts, not just one or two.
Thank you, Dr. Kelly. Zach, I see your hand is still raised. Did you have another question?
No, I'm sorry. I don't have any more questions.
No problem. Does anybody else have a question for Dr. Kelly? Last call? All right, well, that concludes our media briefing. Once again, we thank everybody for participating, and we thank you, Dr. Kelly, for asking questions, and we'll see you next week.
All right, thank you, everyone.